Imagine wanting to protect your loved ones from a deadly virus but being legally barred from doing so. That's the reality for many Americans who want the new updated COVID-19 vaccines but can't access them due to restrictive federal guidelines. But here's where it gets controversial. Even those with chronic health conditions or caregiving responsibilities are facing roadblocks, sparking outrage and confusion across the country. And this is the part most people miss. The debate isn't just about personal choice, but also about how we collectively safeguard vulnerable communities. Take Jason Mitton, a 55-year-old from Austin, Texas, who manages high blood pressure and high cholesterol. Before a recent business trip, he visited a local pharmacy to get vaccinated. The pharmacist, citing FDA rules, refused, stating Mitton didn't qualify. "I think it's ridiculous," Mitton says. "It should be a person's right to decide their own health." His frustration echoes that of Cheryl Hughes, a 64-year-old near Cleveland, who was denied an updated vaccine despite wanting to stay healthy to care for her husband with dementia. "If I get sick, my husband might lose his home," she says. "It would be terrible." The issue stems from a major policy shift. For the first time, the FDA has restricted vaccine access to only those at highest risk of severe illness, people aged 65 or with specific health vulnerabilities. This contrasts sharply with past years when anyone over 6 months old could walk into a pharmacy and get a shot. Health and Human Services Secretary Robert F. Kennedy Jr. and his allies argue that younger, healthier individuals have built up immunity and don't need annual boosters. But critics, including the Infectious Disease Society of America, say this ignores scientific evidence showing vaccines reduce hospitalizations and deaths even in healthy people. But what if you don't meet those criteria? Many Americans still want the vaccine to avoid spreading the virus to at-risk family members. Yet accessing it now requires jumping through hoops. You must either meet the FDA's narrow criteria, get a doctor's prescription, or self-attest to eligibility when visiting a pharmacist. But supplies are inconsistent, and some pharmacies or doctors are refusing to stock the shots altogether. Claire Hannon, a vaccine distribution expert, admits the process will be harder to access, though she insists it's still possible if you're persistent enough to chase down a shot across multiple pharmacies or states. Compounding the problem, the CDC hasn't finalized its guidelines yet. Pharmacists in some states are prohibited from administering vaccines until the CDC releases recommendations. That delay stems from Kennedy's controversial decision to dismantle the CDC's independent Vaccine Advisory Committee and replace it with his own appointees. Many of these new advisors share Kennedy's skepticism about vaccines, raising concerns about what their recommendations might entail. Until the committee meets, vaccines for children, funded by the Vaccines for Children program, won't be distributed, leaving half of U.S. kids without guaranteed free access. Insurance coverage adds another layer of complexity. While Aetna and United Healthcare promise to cover the shots for fully insured plans, others may not follow suit. For those without coverage, the cost could top $200, a significant barrier for many. For families like Allison Coates, the stakes are personal. Her 16-month-old son, ineligible for the vaccine, faces serious risks from COVID. "Why do I have to jump through hoops to protect my family?" she asks. Others, like Karen Lambie, who developed long COVID and now has a weakened immune system, fear spreading the virus to their parents. That could be life-threatening for them. She says, "The situation has led some to consider unethical workarounds." Stephan Neidenbach, a Maryland teacher, admits he's considering lying about his eligibility to get a shot. "I would feel awful if I gave someone I love the virus," he says. Therese McRae, a Utah mother, worries about her diabetic daughter's safety in a world where many are unvaccinated. "It's terrifying," she says. "So where do we go from here? Is the FDA's narrow approach protecting public health, or is it creating unnecessary risks for families and communities? Should vaccine access be based on age and health status, or should it be a universal right? We want to hear your thoughts. Do you support the current restrictions, or do you believe the government is overstepping by limiting who can get vaccinated? Share your perspective in the comments below.